Welcome back to the Tennessee Frugal Craftsman. I wanted to do a short video. This is not like my regular videos where I'm out on the property working. I'm actually in my office, and I wanted to do the 2-year update of my back surgery, which was L4-L5, where I had a blown disc. If you go back a year ago, you will find one, and I'll put the link down below, on what it was like 1 year after. And so I thought I would do a second one of what it is now 2 years after. So it's been about 2 years ago today, or this week, I should say, that I actually had back surgery. For those of you who are first, tuning in, I injured my back 2 years ago lifting on a log when I was prepping to do my for cutting wood for my house, prepping for the house. And I had worked out for a number of years, worked out in the gym, never had any problems lifting weights, but I had lifted the wrong way on a particular log, which is to lift and turn at the same time. So I had probably close to, on a deadlift, I probably was lifting close to, with a pry, maybe 800 to 1,000 pounds plus. It was a big log, lifted up one end of it, but at the same time I had to lean over and put a shim underneath of one of the bunks, that levels up the log on the sawmill. And as soon as I turned with that weight on me, that's when I felt the pop. And originally I thought it was nothing more than a pulled muscle. Come to find out, I actually popped a disc. And then over the next 2 weeks, I continued to work, thinking it was just a muscular thing that I was going to get over. Well, the rest is history. It was a blown disc, and it got so bad that 2 years ago this week, I could no longer walk. So for those of you who are watching my videos today and seeing me moving around, it is a miracle for sure to see me to be able to walk when I was bedridden. And so last year I did a 1 year anniversary on it, just to kind of give you an update of what to expect. So for those of you who are maybe facing the same type of thing. Now, obviously, I'm not a medical doctor, not trying to give advice for that, get that from your medical professional. But I can tell you personally what I've gone through. The first year went pretty well. I was back to doing a lot of what I needed to do. This second year has been pretty well the same. One of the things I noted last year was that I still have some residual numbness in my left leg and ankle. I don't even notice that now. It's not as bad as it was a year ago, and this apparently, according to the doctor, could take years to get over if you ever get over it. And so that is something to note, that if you have back surgery and they're in there messing around with the nerve, that you could have some issues that way. And so that is something I don't even notice for the most part. Now, the one thing that I have had trouble with, and like I said, for those of you who have been following me on YouTube, you will notice that right around Christmas time, I had tweaked my back and was struggling. I had tripped and fell on a slippery pavement, and literally my feet went out from underneath of me, and I was holding a chainsaw, and I kind of wrenched my back. That is something that I have to be careful with. But then again, I've struggled with that throughout my life. I played hockey a lot, and if I would overexert myself playing hockey, playing multiple games in one day, and I've had it where I couldn't walk, or at least be on my back, flat on my back for a couple days. So I've always struggled with that part of it. But then just about, 3 weeks ago, I had another bout where it was the end of the day. I'd worked hard laying floor stringers, and just happened at literally the end of the day, just turned one way to pick up something. I wasn't lifting anything, and I just twisted my back a certain way, and it was kind of that immediate take your breath away kink in your back. That is I'm still getting over that. I'm trying to work through it. Stretching as well. One of my friends had pointed out, the need for stretching, and I try to do that as much as possible. Unfortunately, you get up in the morning, sometimes you don't think about it. But the best thing to do when you're stretching like that is, as you're laying in the bed, to pull your knees up towards your chin, and one in the other, and then both in the same, just trying to stretch that lower back out, and that does help. And so for those of you who have back problems where it's muscular, that can help a lot. Now, as far as the surgery itself, I really have no residual pain from that surgery. It's pretty much done, 2 years out. I do struggle, as I say, with lower back pain if I'm walking a lot on concrete, but I'd always struggled with back pain. Now maybe a little bit more aggravated, so it's something that you need to keep in mind, that kind of the movement on that joint is going to be could be painful if you're walking on hard surfaces. I don't notice it when I'm working throughout the day. Sometimes at the end of the day I will feel it a little bit. That's if I don't have, if I haven't tweaked a muscle or something. I had an MRI done, and I think I noted this back at Christmas time. I had a secondary MRI done. I had some slight bulging in a couple of my discs, but nothing that was out of the ordinary. Apparently, the back surgeon said this can come and go. You can get those slight bulges, and then they'll go back. So that hasn't been something where I've had to worry about having another surgery, at least. But overall, quality of life, night and day. It is night and day from where I was 2 years ago to where I am today. And so I've been able to, if you've been following my videos, been able to do work, lifting things and moving stuff around. Now I'm cautious. I'm very careful about how I lift things. But, at the end of the day, I'm able to do pretty much everything I want to do. And so if, someone was asking me in my advice, about, doing back surgery, it's not something that I would encourage unless you got to the point where I was, and that was where you can no longer walk. And so for me, it was no longer a question. It was something I had to do. It was either that or not survive, that type of thing, because I could no longer sleep as well. Sleep, walk, do anything. And so when you get to that point, it's pretty much a no-brainer. But now 2 years out, looking back, I'm glad I did it. I'm glad I'm actually in a position where I can get around and do what I want to do and trying to get the house built and completed. And so I would encourage anybody who was in that situation to go ahead with it. But it is for each person to evaluate the benefits and the pros and the cons. For me, it was not even a question because I was in such pain. But I don't notice it as much today. Like I said, I can work along all day long, unless I've got that, unless I'm dealing with a tweaked muscle, which I've been dealing with on my right side, my lower right side, where that is kind of the turning. And it's not discal, it's muscular that I'm dealing with. And I think that is residual from just old, kind of that problem I've had for a number of years, but also going back even into my 30s, but even late 20s, early 30s, having that type of muscular issue, but also just the continued usage of my back without stopping. I know the ideal would be to take, a couple months off, rest the back, and get it back to where it needs to be before you start working. But I just, I'm trying to get a house built, and so not doing anything to damage it, hopefully, but just, to get through what needs to get through so I can get into the house and then someday, sit back and take it a little easier. But right now it's really not an option. So anyway, just a quick video. Wanted to give you that update. I know some of you have been following me on that, how the back surgery went and where you are so many, months out. Well, it's been 24 months now, and that's where we are. So as always, appreciate you joining me. If you would, please like and subscribe. Hit the bell down there so you can get notifications on when I have a new video coming out. There'll be more of them this summer, obviously, because I'm working pretty full-time on the house. So be following along with me as the building comes and progresses. There's going to be a lot of exciting stuff and content coming. So until next time, as always, you have a wonderful day.